WYPL TV 18 presents Health Matters with Dr. Mark Castelaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
Welcome to Health Matters. This is Dr. Mark Castelaw, and this is our new show about your health. We're going to have different guests on, different specialists that we're going to have, but more importantly, we're going to have patients on. They're going to talk about health issues and how they dealt with them, because we want you to be very, very informed about your health. I want to thank Mr. Jim Boswell of Baptist Medical Group and Claire Hick in making this program possible. So today what we're going to be talking about is New Year's resolutions. Now everybody this time of year is talking about what they're going to do for the new year. It's always about weight loss. I'm going to start that exercise program. I'm going to stop smoking. And these are the topics that we want to talk about today and give you some information about how to accomplish your New Year's resolutions. So this time next year you can say, well, those resolutions really worked. We're going to have some special guests that had some success stories. And so I think you'll enjoy the show, and our first guest will be right up. We're joined now by experts that we have in the areas of diet and exercise. Our first guest is Christy Davis, who's the Assistant Director of Food and Nutrition at Baptist Hospital. Welcome, Christy.
Thank you.
And our second guest is David Grigsby of Mid-South Rehab. David is a physical therapist and is going to help us with our exercise plan. Welcome, David.
Thanks for having me.
Now, everybody does New Year's resolutions. Everybody wants to lose weight. You know, and is there any success with this? You know, a lot of people come in my office and say, come New Year's, I'm going to lose weight, I'm going to get on a great exercise program, and a few months into it, they have quit. So what we want to try to do today is try to give you some information that can make your New Year's resolution successful. And these two experts here today is going to give us some information to do that. Well, Christy, let's start with diet. Now, you know, you're coming off of the Christmas holidays. You've had pumpkin pie, which is one of my favorites, and turkey and dressing and all of this kind of good stuff. So you're coming off this real high with food during the holidays, and now you're going to get serious and be determined about weight loss. Tell us what to do, how to approach this.
I think that's the best way to describe it, because people they just go all out, oh, well, starting January 1. But I think the first thing is don't set unrealistic expectations. You can't expect to lose 50 pounds in your first month of any type of healthy regimen. So being realistic with expectations, and the first thing, you know, set a weight loss goal. But always, I tell folks all the time, start small. Start small. So a great way to start would say for the first month, so by January 31st, I'm going to lose anywhere from 5 to 8 pounds. And start with that, and then you build your way up with smaller goals related to nutrition and related to exercise. But the first thing is setting that weight loss goal realistically.
Well, Christy, I get this question asked all the time is, what about all of these things that you see on television? Fat burner pill, this pill and that pill, and you can get an injection and make you lose weight. Doesn't all that stuff work?
Absolutely not. There is no magic, mystical item that's going to make you drop 50 pounds and look like a model. There's nothing out there. There are things that...
David looks like a model, but go ahead.
Good job. But no, there's nothing out there, and that's because our bodies are made to work like a car. If we have to feed it regularly, we have to take care of it, or it's going to break down. So there's no pill, there's no magic diet, and actually in my field as a dietitian, I never use the word diet. It's really modifying your current meal plan and following 3 meals a day and including all food groups. And kind of a tip that I do tell patients and even family, friends, and colleagues at the hospital is if there's ever some type of meal plan or diet, if it eliminates a food group, it's really not a good plan, because all of our food groups have important nutrients, have important vitamins, minerals, and we need all of those items to have a healthy diet.
Well, you anticipated one of my questions, and that was about exclusion diets. Diets that exclude all carbohydrates, diets that exclude all fats, the Atkins diet, all of those type of things. Address that.
Absolutely. Carbohydrates, first of all, people think those are like the enemy. You know, don't eat anything white. That's the bad stuff. And a lot of times I'll elaborate and say, well, what do you mean? Well, potatoes. Potatoes are terrible for you. And I'm like, well, is it the potato, or it's what we do with the potato?
It's the butter, sour cream, cheese, and
deep fry
bacon bits.
And why not dip it in chocolate? So, but really any elimination diet doesn't work. And that's because you think of carbohydrates. That has a lot of our B vitamins that help with energy and metabolism. It also has fiber that helps with heart health, digestion. So we need the carbohydrates. It's making the choice between the good carbohydrates and the bad carbohydrates. So your whole grain products, bread, rice, pasta, your beans, legumes, and then trying to limit the cakes, cookies, and pies. Now, I didn't say avoid, I said limit those things, because those are what's going to, it has no nutritional value. That's stuff that we enjoy. I call that soul food. That's good for our soul. And then other carbohydrates are fruits. We need those, vitamin C. Here we are in cold and flu season. We need plenty of fruit. It's how much we eat. And then, of course, some of our vegetables, our potatoes, those are good carbohydrates. And you mentioned fats, and our good fats are very important for helping cholesterol health.
What's an example of a good fat? I don't know what a good fat is.
Sure. Well, I'm glad you asked. Anything that's liquid at room temperature, so your oils. And most people know by now that olive oil is probably one of the best oils. However, it doesn't taste good in a baked good. I tried it one time. It was not very good.
Okay.
So another substitute would be canola oil, and those are higher in our good fats that help with cholesterol health. Another suggestion too is, with our snack foods, chips and things like that, instead of choosing that, go with a handful of nuts or seeds. Those are chocked full of our good fats. And I love Mexican food. That's actually that's its own food group.
So you recommend a burrito a day to keep the doctor away?
Every now and then a burrito is fine, but instead of putting a huge dollop of sour cream, go with maybe some guacamole or avocado, because that has more of your good fats versus the fats that clog up our arteries that are in sour cream, butter, and margarine.
Mm-hmm. I'm already hungry, but now I got to work this off. And David, everyone wants to start exercising, and patients tell me I'm going to get out and I'm going to start running 6 miles tomorrow, and I'm going to do this and do that. What's your recommendations on people to try to start something that they can really stick with?
I think first it's important, if you've not exercised, is to contact your physician and consult with them first, just to make sure there aren't any health needs that need to be achieved first or taken care of first. And if there are pain limitations, maybe consulting with a physical therapist that the doctor may want you to see, just to make sure that there's not going to be any harm from exercise. But yeah, like Christy said, pacing yourself is important, and setting goals. Too often people jump into things they did when they were 20 and now they're 60, trying to conquer new heights that they've not been to in a long time. And they end up having issues or pain that commences from that. So if we can encourage people to take it a little bit at a time and progress into activity slow but sure, they tend to do much better.
Well, David, what's a good exercise I could start with the first of the year?
Yeah, especially if you've not done much in a long time. If you're looking for the biggest bang for your buck when it comes to exercise, the research shows the greatest and the most significant effects from just walking. And walking 30 minutes 5 times a week. And again, that's
and walking is something everyone can do if they're physically able, of course, but you don't have to join a gym. You don't have to spend a lot of money on expensive equipment. Just get out and walk. And there's different places to walk, at the mall, at different churches and things like that.
Yeah, and the health benefits are great. Not only will you see some change in weight over time, it's more of a marathon than a sprint when you're walking to lose weight, but you show reduction of anxiety by 48%, reduction of depression in low doses of walking by 30%, up to 50% reduction of depression in people who walk more. You see decrease in pain, increase in range of motion. You see decrease in heart incidences for people who exercise, as much as 88% reduction of heart disease and heart issues, I should say,
Wow.
with just exercise and walking. So there are huge effects from just walking and being able to move. Christy likened what she does to feeding your car, giving it the right kind of fuel. Movement is much the same way. If you leave a car in the garage for a long time and don't crank it up, it sputters when you first start. So it's important to keep your body moving, keep things from gunking up, if you will, keep things fluid and working the way that they should.
Well, it's a great analogy that both of y'all use, and I use it every day because most people take better care of their car than they do themselves. And I think diet and exercise is so important, especially at the beginning of the year. Everyone wants to do something new, and this is great. So 15 seconds, tell me the best diet to be on.
Like I said, no diet, it's meal plan. 3 meals a day and get your fresh fruits and vegetables, low-fat dairy and low-fat meats, and then choose your salty items and your desserts in moderation.
And David, the best exercise to start with?
Yeah, exercise as far as walking 30 minutes a day, 5 times a week. If you're more advanced than that, then get with a trainer or a therapist and let them progress you along appropriately based on your goals and what your needs are.
You know, if you don't have enough time to exercise 30 minutes a day, 5 days a week, you're too busy. Now, coming up next is going to be a success story that this person followed exactly what these two people said. We're talking about New Year's resolutions, and we've had the experts on telling us exactly what to do about diet and exercise, and excellent information that people really need to put into play. But how does this really affect the average patient? And that's what here on Health Matters that we're going to try to do, is also interview patients that's actually been through this, that they can give us their insight on how they accomplish what they do accomplish. And I'd like to welcome my guest, Robbie Jobin. Robbie, what kind of work you do?
I'm a network engineer for Baptist Hospital.
Baptist Hospital, funny that. Now, Robbie, tell me your story.
About 1.5 years, 2 years ago, I had a lot of reflux. I was taking medicine for reflux disease. I didn't feel well. I was short-tempered. I was tired, fatigued all the time. So I decided, I knew I was overweight, so I decided I needed to lose weight. And as was suggested, I decided to see my doctor first.
And as you said, and as our experts just said, that's always a good place to start, because you never know what might be going on with you. And as we said earlier, a lot of people take better care of their cars than they do themselves. So, see your doctor if you want to lose weight. If you want to get on an exercise program like Robbie did, see your doctor first, make sure everything's okay. So Robbie, you went to see your doctor, and then what?
I got a big awakening. Where I thought I was just overweight, it turned out that I had type 2 diabetes. My cholesterol was too high or too low, all out of whack. Then, of course, with the reflux disease. So it was just a realize that my health wasn't really what I thought it was.
How much did you weigh then?
I weighed about 225, 230, and I got down to about 175.
Wow. Now, was there a family history of obesity or diabetes?
Well, my mother's overweight. My grandmother was overweight, but my grandmother did have diabetes. In fact, she died from the complications of diabetes, and which was a big motivator for me to change my lifestyle. And my father has diabetes, so it was kind of a challenge. When I found out I diet and exercise, I can get off the medicine, I was kind of like challenging my dad, I can do better than he can. And it worked for me. It was just what I used.
Well, just as a note, diabetes, type 2 diabetes today is just rampant. It's just epidemic, especially in the Mid-South as well as the rest of the country. So faced with these challenges of high blood pressure and diabetes, you saw your doctor, and then what was the next step?
After that, I went to a program, a diabetes education program over at Germantown Rehab, and they basically told us about the diet, doctors and dietitians. We learned about proper diet, proper eating, proper exercise, and I just took it to heart. My grandmother was very important to me, and she really motivated me. Even though she's long passed away, I knew I didn't want to die the way she did, and when I ran into tough times, I thought of how my grandmother just took everything real simple. Nothing was a big deal. It was just a little bit of this, a little bit of that, and like I said, I started out trying to lose weight. Then I realized I was trying to lose diabetes, get off the medicine, and then I ended up getting off the medicine and losing weight. So it turned around one big giant circle.
Well, as you said, and what your grandmother said, just to take a little bit at a time. You didn't put all this weight on overnight,
No.
and it's not going to come off that quick as well. So tell me some of the steps that you went through, first with your diet, about what you did.
Well, first I learned nutrition and what I should be eating and when I should be eating it. What I do is I found it was better for me to eat 6 times a day as opposed to 3 times a day. Now, there's smaller meals, but I was never hungry because I was always eating, and which increased my metabolism, which kept my blood sugar in the right ranges, and it just was real simple. And I used a lot of things. I don't normally go to restaurants, and I like to cook myself. So what I would do is instead of using mayonnaise, I may use yogurt, or I'd use the good oils instead of vegetable oil. I don't eat fried food, but I do love fried food every now and then, and I did eat it once in a while. I found out since I don't eat it, it makes me sick now just from not eating all that grease. But it was just a gradual, little things at a time. I kept a phone app, an iPhone app, that helped me keep track of my blood sugar, helped me keep track of my blood pressure, helped me keep track of what I ate, and actually measured out the carbohydrates and the proteins, and kind of kept me on track. And what was kind of good about that app was it told me where I was and how I was succeeding, because it took into effect the basal metabolic rate, which, normal breathing. So It took that and actually said, okay, and it was only, some weeks I didn't lose any weight, some weeks I lost 5 or 6 pounds, but it averaged about 1.5 pounds to 2 pounds a week.
Well, and Robbie, I try to tell my patients this as well, how important it is for you to get involved in your own care, especially people that are type 2 diabetic. It's not all on the doctor, and it's not all on the medicine. It's oftentimes you need to get involved, just like what you're describing that you did, and had such a great success story with that. So, people get so discouraged. One week they'll lose a lot of weight. The next week they don't lose any. They think, well, it's all over with. But what was your experience with that?
Like I said, sometimes I would lose a lot of weight, and other times there wasn't. And I did some research and found out, and talked to the dietitian and the pharmacist, and learned that it's because of the way your body retains water and how it uses the food and the proteins and stuff that you're eating. And sometimes it isn't constant. It'll be, you'll retain some more water where you may not think that you're losing weight. And if I didn't lose weight that week, I just didn't, as long as I kept with the foods I needed to eat, did the exercises I needed to do, I knew it would eventually come around.
What kind of exercise program did you do?
Actually, my exercise program was real simple. I got out of my chair. When at work, instead of sending email back and forth, I would get up, I would go visit the person. Not only did it help resolve problems, because you talk face-to-face communication, I'm walking. I'm getting up. Park in the back of parking lots. I take the stairs. I don't take the elevator. I do go for a walk every day. In fact,
and you notice, folks, that this doesn't cost anything. You don't have to go buy a membership, an expensive membership. These are things that are just common sense. As our guest said earlier, just walking. David Grigsby, our physical therapist, just getting out and walk. And so we can do a lot of things and not cost any money, like what you're talking about.
Yeah, and I found out, I went and got, one of the pedometers,
right,
and was amazed that after a while how much I was actually walking around just doing everyday things. Like I say, just get out of my chair, put the email down.
Now, what did your doctor think when you went back and your numbers were getting better and that you could get off some of your medicine?
Actually, the last time I had a physical with my doctor, what he put in my medicals really impressed me, was he said that my hemoglobin A1C, which is the blood test for...
That you measure, it's a test to let you know over the last 90 days how your blood sugar's been.
And in the note that he sent me was, your blood glucose was 5.5, that of a non-diabetic person.
Wow, what a success story.
So,
So you go from type 2 diabetes, you go from being overweight, blood pressure medicine, diabetic medicine, following the guidelines of diet and exercise, and you lose a total of what?
About 45 pounds.
About 45 pounds. And are you currently on diabetic medicine
I'm
right
not
now?
on any medicine of any kind.
Okay, in the last few minutes now, tell us how to maintain this. You know, it's a great story for you to get to that point. How do you keep it off and how do you maintain it?
Because with me, I made it a lifestyle change, a healthy lifestyle change. If I want to eat if I want a bowl of ice cream, I'm going to eat a bowl of ice cream. But what is a bowl of ice cream? It's a tablespoon. I'm satisfied. I don't do without anything. It's just all portion control. And I basically retaught myself how to eat and how to be healthy.
Well, Robbie, thank you so much for being our guest today. And I just want our audience to realize that if you do these things that our experts talked about, it can really work. And Robbie is a great example of putting into practice some simple things about diet and exercise and having success. Again, this show, we're talking about New Year's resolutions. Have you made your New Year's resolution? Are you going to lose weight? Are you going to exercise? And the other thing that I know I hear a lot of is, I'm going to stop smoking. Smoking is probably one of the hardest things for people to try to stop. And I'd like to welcome our guest today, Connie Haddon. Connie is a employee of BMG, Baptist Medical Group. And Connie, we're very happy to have you here.
Thank you.
Now, Connie, when did you start smoking?
Well, I tried it at the age of 12, but actually started smoking full time when I was 16.
And when you were smoking the most, about how much were you smoking?
About 2 packs a day.
2 packs a day for how many years?
Probably the last 15 years. That's a lot of money.
They're expensive, aren't
Yeah.
they? Well, what made you decide to want to stop smoking?
I did it because of my health and because of the way it looks. You know, I looked at myself in the mirror holding a cigarette, and I didn't like what I saw.
You know, it's very interesting. Back in the 30s and 40s, it was cool to have a cigarette. Humphrey Bogart had a cigarette. But nowadays, it's not so cool.
No, you look horrible holding a cigarette.
Well, Connie, tell me about the first thing that you tried to stop smoking.
There was a antidepressant medication that I tried. It didn't work. I tried patches. They didn't work. Because until you set your mind that you are ready to put those cigarettes down, you can try anything you want. It's not going to take away what the urge, the need. That's all up here.
Now, it's very difficult sometimes for people that are non-smokers to understand what Connie is talking about. Fortunately, I've never been a smoker, but the smokers that I talk to tell me that it's the most addicting thing and the hardest thing to stop. Non-smokers just don't really understand that, but
they don't have a clue.
What's the attitude about that with smokers? With
smokers, when you have that urge to have a cigarette, if you don't satisfy that urge, you're mean. You'll fight someone for a cigarette. To me, it's comparable to an addiction to a drug.
Well, there's been studies that shown that cigarette smoking is comparable to like cocaine addiction.
My family, bless their hearts, when I would try to quit, and I didn't have the mindset and the strength to really do it on my own, I thought, well, I'm going to take this medication. It's going to get rid of everything, and I'm going to get rid of smoking. And I would be so ill. You know, you couldn't say good morning. It wouldn't be the right way.
How many times do you think you stopped and restarted?
Oh, probably 10 times or more.
Really?
Yeah. Oh, I hated smoking. I liked smoking in the fact that when I was nervous or upset, I could smoke a cigarette. It would calm me down. But knowing that I was a slave to something that, you know, I couldn't go to certain restaurants because you can't smoke. You know, you have to go outside to smoke. You know, you can't go to the movies because you can't smoke. And in the middle of the movie, you have this urge to smoke, so you have to go outside and smoke, and you miss part of the movie. It's truly a slave.
Well, Connie, I got one question. Did you ever read that little thing on the side of the package of cigarettes?
I did. It didn't apply to me.
Oh, it didn't. You were the one you were going to skip that.
Yeah.
Because if you'll read that on the side of the cigarettes, it says, this this will kill you, dummy. So don't do that.
My doctor told me that a lot too.
Oh, your doctor told you
Yes, he
that?
did. He
well,
sure did.
Connie, eventually, how did you stop, and how long have you been quit?
I've been quit since April of last year. So I've been quit, this April will be 2 years. I got on some medication and I started on it, but I also set my mind that I was going to do it. I did it one day at a time. Each day that I didn't smoke, I would say, I quit smoking. This is day one. I made it through day one. I made it through day two. You do it one day at a time. You don't look down the road and say, well, I'm going to look towards, I'm going to be a non-smoker in 6 months. You do it daily.
Well, I just want to say congratulations. And I just want to tell our audience, there's a lot of things you can do for your health with diet, exercise, do the things your doctor tells you to do. But I'm telling you, if you're a smoker, one of the most important things that you can do in this new year is to please stop smoking. Well, today on Health Matters, we've learned some do's and don'ts about diet and exercise in this new year. Everybody's got New Year's resolutions, and I hope this year that you can stick to your New Year's resolution, following a healthier diet, exercising more, and please, please, please stop smoking. These people did it, and I think you can too if you'll just follow the recommendations given today. Now, in closing, I'd like to pass along some information about a dedicated Baptist employee that we lost in 2013. Barbara Klein Bauer was an employee of the medical group for over 50 years. Barbara was the heartbeat of the medical group, and we're going to miss her dearly. Her best man in her wedding was the king of rock and roll, but today she walks with the King of Kings. And we're going to miss Barbara, and we want to dedicate this program to her. Now, next month will be February, and February is Heart Month. And we're going to have doctors from Stern Cardiovascular to educate us about what to do for our heart and how to take care of ourselves. We're going to talk about new procedures in heart revascularization. We're going to talk with a heart surgeon. We may even have some video footage of some actual heart surgery so that you can see. But what we want to do is try to educate you about your heart and for you to take care of yourself. And now, for Health Matters, this is Dr. Mark Castelaw. Thank you for joining us, and join us next time on Health Matters, because your health matters.
More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Get better.
Every weekend, my husband drinks until he passes out. But I'm finding support and understanding at Al-Anon family groups. Are you troubled by someone's drinking? Call 1-888 for Al-Anon or visit alanonfamilygroups.org.
Tools sure make our lives easy, but a tool is only as useful as the hand that holds it. When it comes to straightening crooked teeth and misaligned jaws, orthodontists have all the right tools in their toolbox. They're the most skilled professionals to oversee your care. Orthodontists have the expertise that comes with 2 to 3 years of specialized education beyond dental school. They know best which instruments to use when correcting orthodontic problems. Put your smile in the right hands. Visit braces.org.